Hello, everyone. I'd like to welcome you for the presentations organized by the Central Laboratory in the female campus, King Saud University. As we are in the middle of this pandemic, I wish that you and your loved ones are in a good health and staying safe. Thank you for joining us for today's presentation entitled Gut-Lung Crosstalk in COVID-19, Pathology and Fatality Rate. The presentations will be presented by Prof. Afaf Elansary. My name is Dr. Hanan Balto, and I'll be the moderator of this session. Before we get started, I'd like to inform you that the presentation will be live broadcasted on KSU YouTube. However, if you have any questions or comments for our speaker, please send it through her email elansary@ksu.edu.sa and will be answered later by the speaker. And now let me introduce our speaker. Prof. Afaf Elansary is a biochemist graduated from Ain al-Shams University in 1974. She worked in the National Research Center Egypt from 1976 till 2000. Between 2001 and 2016, she worked as a professor in Biochemistry Department, College of Science, King Saud University. Since 2016 till now, Prof. Afaf joined the Central Laboratory as a senior scientist to supervise the biochemistry, proteomic, and biomarker units. She has published more than 150 papers related to biomarkers of autism spectrum disorders. She was recognized by the Marquis Who's Who in Science and Engineering, 8th edition, 2005-2006. She's a member in a number of national and international societies, and she's recorded as a reviewer and editorial board member in many international journals. She's a member in the European Society of Predictive, Preventive, and Personalized Medicine Society. Recently, she has appointed as the head of Saudi group related to the Nutritional Council for Nutritional and Environmental Medicine. Prof. Afaf has research interest in nutritional biomarkers directed strategies to treat autism spectrum disorders as safe and non-invasive intervention methods. Without further ado, we'll start the presentation. Prof. Afaf, the mic is yours.
Okay. Thank you, Dr. Hanan, for your introduction and for your great arrangement of my talk. The title of my talk, as you see, is Gut-Lung Crosstalk in COVID-19 Pathology and Fatality Rate. So far, there is no vaccine or treatment for COVID-19, and we need to follow certain precautions in our day-to-day living, such as social distancing, hand washing, fluid uptake, etc. Today, I would like to discuss what we can consider as an additional precaution, mean gut microbiota. Objectives of my talk is highlighting the role of gut microbiota in health and diseases, understanding the mechanism of gut-lung crosstalk and its relation to COVID-19 pathology, discuss the protective role of probiotics and prebiotics against coronavirus infection and aid in avoiding COVID-19 increased fatality, role of probiotics, prebiotics, and symbiotics in boosting the immune system to prevent or potentially fight coronavirus infections. Actually, recent developments in microbiota studies have led to a better understanding of the impact of populations of commensal microbiota within our body. The role of gut microbiota in health and disease is being progressively studied, but still it needs more understanding. Gut microbiota usually classified into good and bad bacterial flora. Among the good bacterial flora is bifidobacteria and lactobacilli. I want to pick your attention to these two strains because I'm going to talk later on about both of them. And bad bacteria like Campylobacter, Enterococcus, Clostridia difficile. Actually, there are trillions of bacteria, but only I'm going to highlight some of them. Actually, before we go to this, the distribution of the gut of the microbes along our body, I want to raise a point that by having good bacteria in our body, bad bacteria don't get a chance to grow and cause disease. This we should put this in our mind. And it is well accepted and documented that a diverse and balanced gut microbiome enriched with healthy bacteria or probiotics contributes to healthy life, especially in old people or those with chronic disease. And so, modulation of the imbalanced gut microbiome in old people or chronic disease would ameliorate the symptoms and increase the quality of their life. Here you can see that normal flora can be found in many sites of human body, including nose, mouth, lungs, stomach, colon, sexual organs, and skin. But of course, I'm going to give special attention to colon and lung because these two sites are related to the topic of my talk. Dysbiosis. What is dysbiosis? Dysbiosis is a condition caused by an imbalance in the bacterial community of the human gut. Good bacteria are responsible for health and play various roles in the digestive system. But when these bacteria become imbalanced, I mean, when the bad ones overpowering or outnumbering the good ones, it can lead to illness. These dysbiosis clinically present as diarrhea, constipation, bloating, and يعني unable to digest properly. As you see in the figure, it can be related to illness in many organs in our body. For example, in the brain, imbalanced gut microbiota is related to depression, schizophrenia, autism, Alzheimer's disease. In muscle, chronic fatigue syndrome, adipose tissue, it is related to obesity, related to kidney dysfunction, or unfortunately renal failure, abnormal blood composition, type 1 and type 2 diabetes, liver disease, and lung disease, heart disease, everywhere. Recently, gut microbiota was found to be related to almost all disease. Here you can find, due to the importance of gut microbiota, we start to found some scientific expression like gut liver axis, gut retina axis, gut lung axis, gut brain axis. Actually, this bidirectional pathway, it means that the pathway between the gut and each of these organs, the gut can affect the organ, and on the opposite direction, the organ can affect the gut microbiota. For example, let me take gut-brain axis as an example. It is well known and documented and accepted that healthy brain means healthy gut, and healthy gut means healthy brain. This is from my research interest in autism. For example, autistic patients, they have 10-fold higher Clostridium species, which is a pathogenic bacteria. And this overgrowth of pathogenic bacteria usually related to the clinical presentation of the disease, and this is the same for Alzheimer, for depression, or for stress. And as you see in the figure, all these axes are bidirectional pathway. It means that healthy gut microbiota needed for the normal detoxification and metabolic function of the liver. Healthy gut microbiota needed to stop age and diet macular degeneration in the retina. It is needed to avoid cystic fibrosis or asthma or influenza virus infection related to lung as an organ. And before I talk about the gut and the brain. Usually, this is usually happens through what is known as vicious cycle in clinical illness, through which disordered bacteria or microbiome in the gut induce inflammation, and inflammation finally lead to tissue injury. I'm going, of course, to concentrate on gut-lung axis. How, out of these axes, gut microbiota brain axis actually can be related to COVID-19 pathology. As you know, all of us can feel that COVID-19 outbreak may be stressful. All of us are under stress. We should don't ignore that we are stressed. Fear and worry about our own health and the health of our loved ones is very common and expected. It is a common feeling. But coping with stress will make us and the people we care about and the whole community, it will affect the whole community. If we escape our feeling with worry and fear, then our immune system will be stronger to fight coronavirus. So let us talk about the gut-brain axis a little bit in detail. Of course, it is well known that if we are under stress, then our brain, through the hypothalamus, pituitary gland, adrenal gland axis, it will induce the release of cortisol, which is a stress hormone. Cortisol as a stress hormone, it's well known to affect our immune system. So if stress, feeling loneliness, and sleep deprivation, because if you are feeling stress, it usually induces sleep deprivation, it will make us more prone to COVID-19. So we must be a little bit relaxed. We should not be so worried about what is going on. Of course, all of you know that COVID-19 or coronavirus infection started in Wuhan in China. Now let us start to talk about respiratory tract microbiota, because as you know, the title of my talk is Gut-Lung Crosstalk. If I want to talk about respiratory tract microbiota, it's well known that in addition to the upper respiratory tract, the lower respiratory tract, the lung, is also colonized with various types of microbiota. The diversity of the lung microbiota is mostly affected by three major factors. What are these factors? First is the type and number of microbiota reach or arrived into the lung. Second, the removal of microbes from the lung. How the lung and the immune system are able to clear or to remove the microbes from the lung. And third is the replication rates of the microbes itself within the lung tissue. Gut microbiota disruption, which usually caused by antibiotics, decrease the pulmonary resistance to Staphylococcus aureus due to the impaired toll-like receptor. Now we will start to know how the imbalanced gut microbiota or the dysregulated gut microbiota can affect the lung. For example, as you see here, Staphylococcus aureus as one of the microbes which usually affect the lung. If the patient has imbalanced gut microbiota, he usually have less number of toll-like receptors. These receptors are critically needed for the early recognition of the pathogens. And here the pathogen is virus, and especially if we are talking about COVID-19, so it is coronavirus. So balanced gut microbiota means less toll-like receptors, less ability of the patient to recognize coronavirus as a pathogen. A recent study provided that, how they understood this? A recent study provided that gut-lung microbiota develop simultaneously, and there is a constant crosstalk between these two compartments. Recently, certain gut microbiota associated strategies have been approved to treat and prevent lung disease. So if this is true, it means that yes, it is there is a gut lung crosstalk. If the lung state improve when I do intervention using probiotics or healthy bacteria, it means that there is a gut lung crosstalk. It's also suggested that the healthy gut microbiota played a critical role in the generation of virus specific CD4 and CD8 T cells and antibody responses after respiratory influenza virus. So if I have healthy gut microbiota, it means that I have normal number and function CD4 T cell and CD8 T cells, which is through the antigen presenting cell and measure histocompatibility protein 1 and 2. They will lead to mature helper T cells and cytotoxic cells. Both can help to attack and the coronavirus or any pathogen at the beginning of infection. Okay, let us know more how they are interacting. Actually, it is well known that reduction in the diversity of the gastrointestinal tract microbiota was followed by a considerable increase in mortality due to to respiratory viral infection. Actually, this is the concept of my talk. The concept of my talk is that let us make use of our gut microbiota. Let us help our gut microbiota to be healthy enough to help our immune system to attack COVID-19 infection and or also secondary infection or avoid getting secondary infection, so we can decrease either the clinical presentation of COVID-19 infection or the fatality rate. We can decrease the number of people who die due to the COVID-19 infection. How this happen? It's well known that increase in mortality of respiratory viral infection was associated with a defective immune response characterized by increased lung interferon gamma, interleukin 6, and CCL2 as a CC chemokine, and decreased count of T regulatory cells in the lung. How they know this? They know this because neutralization of interferon gamma or adaptive transfer of T regulatory cells usually help to decrease the rate of mortality in COVID-19 patient or any viral infection patient. Let us have a look to the figure to the right hand. Let us start with the COVID-19 infected lung on the top. COVID-19 infected lung usually lead to induction of gut microbiota alteration. COVID-19 infected lung will induce dysbiosis. Dysbiosis means lower lactobacillus and bifidobacteria as important probiotics. We will talk about it later on, inshallah. And this dysbiosis will induce higher interferon gamma, interleukin 6, CCL2, which will induce the or help secondary infection with Staphylococcus aureus, and this of course lead to higher fatality rate. Also, it was found that viral lung infection are also associated with abnormal concentration of mucin 5AC and lipocellin as marker of gut inflammation. It means that during COVID-19 infection, there is inflammation in the gut. Some patients with COVID-19 presented with dysbiosis of gut microbiota. This is well reported. Actually, most of the research about COVID-19 and gut microbiota, it was from December 2019 till now. So yeah, it is a very short period for doing research. But because of the outbreak, all people were so interested to understand what is going on. So among these studies, some patients with COVID-19 was found to present dysbiosis of gut microbiota with decrease of healthy bacteria or probiotics such as lactobacillus and bifidobacteria, which I pick your attention on the first to these two. So if COVID-19 patients have much lower lactobacillus and bifidobacteria, it means that they present imbalanced gut microbiota. Disordered microbiota, and they have, of course, they have clinical presentation like diarrhea, constipation, all this. But it depends on the degree of imbalance of the gut microbiota. Based on this, they start to think about nutritional intervention through treatment with prebiotics or probiotics, just to restore the balance of the gut microbiota, to avoid the risk of secondary infection due to bacterial translocation. COVID-19 and the probiotics as intervention strategy. Let us first define probiotics. What are probiotics? Probiotics are defined by the World Health Organization as live microorganisms that, when administered in adequate amounts, confer a health benefit on the host. They are healthy bacteria which, when given or supplemented, they will help us to be in a better health. The most commonly used probiotic are Lactobacillus, Bifidobacteria, followed by the genera Propionibacteria and Streptococcus. But what is prebiotic? Prebiotics simply are types of dietary fiber that feed the friendly bacteria in the gut. It means that prebiotic feedings on prebiotic will induce the growth of healthy bacteria. How they can be clinically given. Clinically, probiotics have been classified as monostrain or multi-strain products. Of course, with multi-strain products being more beneficial due to the expected symbiosis among strains. They can be given as monostrain, for example, pure lactobacillus, pure bifidobacteria, or multi-species we can use as a mixture of more than one species. And actually we have done some research related to this, and it was efficient to ameliorate some of the biochemical autistic features, but in animal model, in rodent model. But still, also there are some clinical trials through which they can treat autism using prebiotic and probiotic. If I'm talking any talk, I cannot stop myself from talking about autism. This is my research interest. In addition to orally supplemented probiotics, fecal transplantation can be used as another strategy of probiotic microbial intervention. What is fecal microbial transplantation? Fecal microbial transplantation means the process of transferring gut microbiota from a healthy individual to a dysbiotic patient. I am transferring the gut microbiota from balanced gut microbiota individual to imbalanced gut microbiota patient in an attempt to restore the diversity of the patient, of the gut microbiota of the patient. It is based on the rationale that manipulation of the microbiome of the patient, of course, could prove potentially therapeutic for disease state with an altered microbial composition. And it is used many times to treat these biotic patients. It is already used as intervention. Okay, now what is symbiotic in treating respiratory tract infection? Synbiotics was reported to be a more potent preventive measure in treating respiratory tract infection among adults, but not that effective in infants and children. Actually, to understand the etiological mechanism of any disease, it is recommended to use rodent model or animal modeling. So regarding the gut-lung crosstalk, it was found that mice model is very useful to understand what is going on between the gut and the lung and how each organ can affect the other. Here you can see that we can use probiotics alone, prebiotics, or a mixture of both, which is known as symbiotics. What is going on about probiotics and secondary infection in COVID-19? It is well accepted that when antibiotics are used, a strengthening of gut microbiota by using probiotics is highly recommended. Why it is highly recommended? It is highly recommended because it helps to lessen the susceptibility to secondary infection as commonly happens in COVID-19 patients. Most of COVID-19 patients, they used to develop or to have secondary infection, mostly with Streptococcus aureus. In addition to the effectiveness of probiotic in treating respiratory tract infections, they are also proposed to have a direct effect on severe acute respiratory syndrome of coronavirus infection. Is there randomized clinical trials using probiotics for the treatment of COVID-19 patients? Yes, the answer is yes. In line with the gut-lung crosstalk, which has been anticipated to play a critical role in COVID-19 pathogenesis, recent randomized controlled trials showed that critically ill patients on mechanical ventilators who were given probiotics like lactobacillus or enterococcus developed less ventilator-associated pneumonia compared with placebo. It means that they already tried to test the effectiveness of probiotic in treating critically ill COVID-19 patients. Lactobacillus and the enterococcus were efficient to decrease the complications of those on ventilator. This finding might contribute significantly to reducing fatality rate. This is the concept of my talk, how we can reduce the fatality rate through the use of non-invasive treatment strategy like probiotics. Okay, Chinese COVID-19 patient demonstrated microbial dysbiosis with diminished lactobacillus and bifidobacteria. This is a very good sign which helps to decide that we can contribute using probiotics. Lactobacilli and bifidobacteria are the only two types of beneficial bacteria that were accepted for combating COVID-19 through the restoration of healthy gut microbiota. Of course, these are two healthy probiotics, so if they administer, they will compete for the pathogenic bacteria, and of course, it will restore the balance of the gut microbiota. But random use of conventional probiotics for COVID-19 management, of course, it is not recommended until clear understanding of the pathogenesis of coronavirus and its effect on gut microbiota is attained. We should first understand how exactly the gut microbiota are interacting with the lung, and then we can use probiotic for intervention. It is likely that a novel and more precise targeted approach to the modulation of gut microbiota might be accepted as one of the therapeutic mechanisms to combat COVID-19, but still we understand clearly how they can affect the lung. Okay, now let us move to probiotic and tracheal colonization with pathogenic bacteria. Based on the currently available clinical data, it seems that dietary probiotic, now you are familiar to probiotics like lactobacillus or bifidobacteria, either monostrain or multistrain. It seems that these dietary probiotics don't induce a major risk for oral health. Therefore, probiotic therapy can be considered as a natural and non-invasive way to prevent tracheal colonization with pathogenic bacteria and reduce the risk of aspiration of contaminated secretion. However, again, high-quality randomized clinical trials with long-term follow-up is very important. With long-term follow-up are needed to confirm its clinical benefit in critically ill patients. Again, it was found, and that is why they are thinking about the use of probiotic in treating COVID-19 patients, because UETA reported that weak immune system was related to gut microbiota imbalance in 3 critical care patients with COVID-19. But see, only 3. So we want to have same reports, but from a much higher number of patients in order to be confirmed. But here only the study, these are the number of patients who are available for him. That is why it is only 3 critical care, but still it can give us an indication that there is a crosstalk between the lung and the microbiota. Also, they found that hypoxemia severity was correlated to the vicious circle between immune deficiency and the gut microbiota. Back to the vicious cycle in critical illness, as I explained before, imbalanced gut microbiota usually lead to inflammation and finally to tissue injury, and here the tissue or the organ is the lung. More to understand, it was reported that COVID-19 patients have lower level of regulatory T cells, and this lower level of regulatory T cells was correlated with the severity of the disease or of the case. I mean, the more lower, the more severe. The more lower number of regulatory T cells, the more severe the clinical presentation of COVID-19 patient. Thus, these markers might help in the early diagnosis and thereby better management of novel coronavirus infection. Actually, it is very important. Early diagnosis is very important for any disease. And for such a fatal disease like COVID-19 outbreak or infection, it is very, very, very important. See, here you can see again that gut probiotic can help to restore a number of T helper cells, and it can induce, you can see here, that probiotic means healthy bacteria like lactobacillus and bifidobacteria. They can induce the number and the function of macrophage and dendritic cells, T helper cells, and induce immunomodulation to keep gut-lung axis healthy enough to be less susceptible to asthma or to viral infection or to any lung disease. A probiotic is related also, it can also help the immunomodulation through T helper cells. Another mechanism, it must be said that major mechanism of probiotic effect on the respiratory tract, still, as I said before, it is not yet understood, but simply it is, as I said before, also it is a competition between the growth of probiotic healthy bacteria. If they are in large amount supplemented, so they are in much higher amount, they will compete for the nutrients with the pathogenic bacteria, and at the end they will be much higher healthy bacteria compared to pathogenic bacteria. The homeostasis or the balance of the gut microbiota will be restored, which will help the immunomodulation. It has been shown that probiotic can influence both innate and adaptive immune response by producing exopolysaccharides. Here you can see that probiotic can affect innate immunity through macrophage, natural killer cells, neutrophil, dendritic cells, cellular, or through the adaptive immunity through T cell and B cell. But it is very interesting to know that probiotics producing exopolysaccharides. What are exopolysaccharides? As you see in this figure, lactobacillus, as one of the two most famous probiotics, it usually produces exopolysaccharides as a prebiotics. It means that probiotic can produce prebiotic. Lactobacillus can produce exopolysaccharides as a sort or as a type of prebiotic. And as you see here, exopolysaccharides is usually related to a cardiovascular system. It induces lower blood cholesterol, so they have cardioprotective effects. They induce immunomodulatory activity, so they will boost the immune system and also the gastrointestinal tract. So here, lactobacillus probiotic produce exopolysaccharides as a form of prebiotic. Here, simply, we can compare both conditions, dysbiosis and the balanced gut microbiota, to summarize what we have talked about. See here, in dysbiosis, if I suppose that this is a dysbiotic patient with imbalanced gut microbiota, we can see that imbalanced gut microbiota in the dysbiotic patient, he has pathogen multiplication, much higher pathogenic bacteria than healthy bacteria. Of course, this will accompany with altered immune response, poor immune response. Altered microbiota means less diversity of the microbiota, more pathogenic compared to healthy. Finally, tissue damage. And if the tissue here is the lung, it will, of course, increase the fatality rate of any disease. And I mean here we are talking about COVID-19. What will happen if I can restore the imbalanced gut microbiota in this dysbiotic patient to be balanced through the use of probiotic? Then there will be a more stronger immune response, pathogen clearance, tissue restoration, because here the diversity will be normal. The gut microbiota will be balanced. More healthy bacteria, more lactobacillus, more bifidobacteria compared to other pathogenic bacteria like, for example, Clostridia species or any other pathogenic bacteria. Another mechanism, probiotics are also able to increase the expression of interleukin 10. Of course, all of us know that interleukin 10 is anti-inflammatory cytokine. Probiotic able to increase the expression of interleukin-10 as anti-inflammatory cytokine and decrease the pro-inflammatory cytokines expression such as tumor necrosis factor alpha, interleukin-1 beta, and interleukin-8. Furthermore, probiotics was found to maintain higher level of salivary immunoglobulin A as another sort of immune response, and produce bacteriocins and returins which have antimicrobial effect. Here you can see that these peptide bacteriocin, for example, it can help in colonization. If we give probiotics, it will induce the secretion of bacteriocin, which will help the colonization of healthy microbiota or healthy bacteria. It can also help to kill the pathogen, the same peptide. It can help. It can be used as killing peptide. They can be used as colonizing peptide, killing peptide, and signaling peptide. As colonizing peptide, okay, we understood that they will increase the colonization of healthy bacteria. As killing peptides, they will fight the pathogenic bacteria. As signaling, then they will induce some factors which will increase or boost the immune response of any patient. Here I'm going to summarize what we have said before. Here we have different reported mechanisms of the favorable effects of probiotic supplementation. As we see, first, they are help in the balancing of the gut microbiota, competitive inhibition of gut pathogen, control of gut barrier motility, because it's well known that in case of imbalanced microbiota or dysbiosis patient, there is increase in the intestinal permeability state or condition known as leaky gut. And leaky gut is one of the most important problem of this biosis. So probiotic can be used to treat leaky gut. Secondly, activation of innate and adaptive immune responses, production of exopolysaccharides. Now we know what does it mean, exopolysaccharides, and how it has many protective effects. Increase of leukocytes, neutrophil, and natural killer cells counts and activities. Moreover, it protects against lung infection with Klebsiella pneumonia, decrease secondary infection burden, increase toll-like receptors, which I have talked about it before, which is very important for the early recognition of any infection, and especially or even in COVID-19 infection. Increase interleukin-10 and interleukin-17 as anti-inflammatory cytokine, and in contrast, decrease pro-inflammatory cytokines like tumor necrosis factor alpha, interleukin-1 beta, interleukin-8, higher salivary, as I said before, IgA, production of bacteriocins and reticins. So these figures summarize most of I have explained before. Here there is very important things we have to think about it. See here the title, a hidden factor in stroke severity. A hidden factor in stroke severity. What is the hidden factor? The microbes in our gut. So it's very important if we are dealing with COVID-19 patients, because as still we don't understand the etiological mechanism, but some patients of with COVID-19 infection usually die due to strokes, as you will see later on. And they found that imbalanced gut microbiota can be related to the severity of stroke. This slide I just added today, actually, to my presentation. When I think, is it okay to present the role of gut microbiota in relation to stroke severity? Then I think, let me see if actually some patient of COVID-19 are passed away with stroke, either it is brain stroke, heart stroke, lung stroke. So I went through the internet and I was shocked when I found this. There are a number of reports, as you see, many numbers. I only take some. There are numbers of reports showing that young and middle-aged people who are infected with COVID-19 are dying of strokes. Those between 30 to 40 years of old, if they got infection with COVID-19, most of them, this is what is reported, it's not my report, this is what is reported here, most of them usually passed with cardiac stroke, lung stroke, brain stroke, whatever. But until recently, there was little hard data on stroke because the short period, as I mentioned before, it is a matter of 3 or 4 months only. This is for COVID-19, but for the relation between gut microbiota and stroke, it is well reported. It is accepted that imbalanced gut microbiota is related to the severity of stroke. So if we keep our gut microbiota healthy, we can avoid getting strokes. Here you can see a type of prebiotics. Actually, we should take care with our food, especially during this outbreak or pandemic, because as you see, many prebiotics can help to restore the imbalance of our gut microbiota, like apples, garlic, leeks, onion, bananas, and others. Here you can see that either we can use prebiotics. Now we know prebiotics, that it is a substance that can only be metabolized by the gut microbiota and not the human host. Probiotics, like lactobacillus and fidobacteria, and symbiotics when we take mixture of both. And there are many products. If you want to take probiotics, pure probiotics, there are many products. Prebiotic, of course, we should take care with our healthy food. Symbiotics, there is, as you see, also there are many products. Now I'm going to my conclusion. Up to my talk, you can see that the use of probiotics is an interesting emerging field in oral health care as preventive target against COVID-19 infection. Based on the currently available clinical data, it seems that dietary probiotics don't induce a major risk for health. It is safe enough. It is non-invasive and safe enough. Probiotic therapy can be considered as natural and non-invasive way to prevent tracheal colonization with pathogenic bacteria and reduce the risk of secondary infection pneumonia as a comorbidity in COVID-19 hospitalized patients. However, high-quality randomized clinical trials with long-term follow-up are needed to confirm its clinical benefit, especially in critically ill COVID-19 patients. Actually, I want to share with you this slide. This is my own gut microbiota profile. Last year, I was attending a conference in Moscow, autism conference, the 7th autism conference in Moscow. And one of my friends, Dr. Professor Alex Politev, he asked me to give, see, it's very small. They withdraw a very small blood drop from my finger. And after I came back, he sent this mail to me. He said, "Dear Afaf, I am glad to inform you that your microbiota is quite good. And when I go through when I go through the report of gut microbiota, actually I was so happy because actually I have a quite good microbiota. Now you can accept that I have a quite good microbiota because I found that I have too much bifidobacteria, much higher bifidobacteria, much higher lactobacillus and propionobacteria. So I have a good diverse, and of course many others, which means that the diversity of my gut microbiota is quite good, and there is a more probiotic, there is a more healthy bacteria compared to pathogenic bacteria. Please stay home, stay safe, and thank you for listening. And I hope إن شاء الله ربنا يرفع عنا الوباء والبلاء. ألف شكر لاهتمامكم. شكرا.
Thank you so much, Prof. Afaf, for your informative and evidence-based presentations.
Thank you, Doctor.
In fact, you shed the light in very interesting issues using of probiotic as a treatment or as a strategy for treating critically ill patients in COVID-19 is an interesting area. And as you conclude your presentation that although it's still, there is more studies are needed to confirm its efficacy with a long-term follow-up.
Yeah.
Based on your last slide, Dr. Afaf, do you recommend a regular screening of the intestinal gut microbiota?
Yes, after my personal experience, actually, because I never think that my gut microbiota is good enough, because I'm not taking that much care with my food. I'm not always eating healthy food. But when I found my gut microbiota good like that, I realized that behind this microbiota is that I was green onion lover. So it improved that prebiotics can help to keep our microbiota healthy.
So do you recommend it on a certain
of
age
course.
or?
But I think it is very expensive to have the full gut microbiota from a small drop. I think it is very expensive, but to be done regularly, it is very important, because by time it is more and more confirmed that gut microbiota is related to any disease, and taking care with gut microbiota can help to avoid many complications. For example, we did some work on diabetic patients with and without retinopathy, and it was found that there is the diabetic patient who develop retinopathy, they have a large amount of, I don't remember the name of bacteria, but a large level of overgrowth pathogenic bacteria. It means that if we do the screening for diabetic patients before they develop the retinopathy, then we can help them to avoid retinopathy through restoring a healthy gut microbiota.
Okay. Going back to the fecal transplant, do you think it's safe enough to be used regularly in dysbiotic patients?
Actually, regarding fecal transplantation, there is important safety alert regarding the use of fecal microbiota, because it is although if it is of great help, but there is some risk of serious adverse reactions. Sometimes, such as you can, if you transfer the whole profile from one healthy to another dysbiotic patient. There was one case that the patient, he passed away because he was sensitive to one or two of the bacteria transferred to him. So I think it is helpful, but it must done with great care and through professional people.
Okay, so it is a sensitive procedure.
Very sensitive, but it is helpful. And they are using now as intervention, but it must be done with great care.
Going back to the probiotic and prebiotic, which one is more efficient for balanced microbiota, the prebiotic or the probiotic?
Actually, to answer this, the benefits of prebiotics have linked to the benefits of probiotics, because I'm taking prebiotic to induce the growth of probiotics. But the problem is that it depends on the patient. For example, if he is a critically ill patient, so it's very difficult to give him prebiotic, but it can be directly supplemented with probiotic. Because the reach to prebiotic is not that easy, because I have to eat a lot in order to get satisfactory amount of prebiotic to induce a probiotic. But probiotic is directly given, which can give more effect.
Mm-hmm.
But sorry, doctor, but if I want to be in the safe side, let us take care with our food choice. From the beginning. Why I'm giving this lecture? Because during this period we are sitting home. Let us take care of our food. We make more eating of prebiotics to induce or restore the balance. If we are imbalanced, we restore the balance. If we are already balanced, we keep the balance of gut microbiota.
Okay. Away from the COVID-19 and being a dentist, I'm just wondering if there is any application for the probiotics when it comes to the oral health.
Actually, it is safe for the oral health and non-invasive. I think it can be taken through mouthwash. It can be mouthwash can help to avoid at least it can help to avoid the secondary infection through the trachea. I think, but I'm not sure.
Okay. Lastly, Prof. Afaf, is there any take-home message that you'd like to share it with our attendees?
Yes, please take care with your gut microbiota. Treat your gut microbiota as your protective tool to be healthy enough to avoid COVID-19 or any infection. And if la qadar Allah we get infected, our immune response will be strong enough to fight. This is the home take message.
At the end of the sessions, I'd like to thank you again, Prof. Afaf, for your participations and informative presentations. Also, I'd like to thank our attendees and I hope all stay safe and healthy. Thank you all and see you later, inshallah.
Thank you, Dr. Hanan. Thank you.
الله يحفظك. في أمان الله.
مع السلامة.